It's so important that we don't forget where we've come from. It was an important part of the work that I had back beginning in the 80s through the 90s to transform Toowoomba's hospital service, to understand where we've come from. We build upon the shoulders of those who've preceded us, and there are important lessons that we need to learn from our past history. We're extremely grateful for the Darling Downs Health for granting us this building and the surrounds, and I'm looking forward to seeing these grounds significantly planted with trees, herbs, shrubs that our First Nations people used for bush medicine purposes.
The Baillie Henderson Hospital, which this is a part, was first opened in 1890 as a mental health institution, and it was very important and innovative for its day. This house has been in use for quite a long time and a large part of the history of the site. I think it's really important that this building gets a use so that it can be retained and visited. It's a great opportunity to display elements of the history of the hospital and make them publicly accessible, and I think that's the ideal balance that we're trying to achieve.
We're local people first and foremost. We're builders, we like building stuff, but to build stuff that's going to add something to the history or to promote the history of the town in which we live and hopefully be a significant part of the community moving forward is always special. This is a hugely significant site. It's a beautiful campus. It's got a heap of history. It's obviously just about to go through an evolution where it's going to take form as the new hospital for this town. And I think to not recognise where it's come and not celebrate that in some capacity would be a missed opportunity. So yeah, we're grateful to be involved in preserving at least part of the history of the site.
So there have been two previous museums, Toowoomba Hospital Museum and the Baillie Henderson Hospital Museum. Collections of those are currently in storage, and we intend to exhibit those along with the extraordinary narratives of health history from Indigenous times to the present day in this building. All of the artefacts and all the stories, of course, won't be presented here at any one time, but we'll be presenting themes. They will change every few months. There'll be a different theme. So when visitors come to this museum, they won't necessarily see the same thing twice.
I'm so excited. You're just bringing something that quite a lot of people don't even know existed here in Toowoomba. I was one of those people, but just to bring the history and the stories to the world, basically, is just so exciting. It's fascinating work. It's something that I wish I had known about when I was doing career choices when I was 16.
I wasn't ever in the town, I was always out in the bush, and we'd hear about this place, and we knew a few people who'd been in here, and it just seemed a wonderful part of history, and the more you got in and looked around, the more interesting it was.
Working with a group of volunteers that are sort of passionate with what we're doing. I think it's wonderful that we've all got this idea that we're part of something that's going to contribute to our community, not only just our community, but Australia-wide and worldwide, hopefully. I mean, it's exciting to the fact that, you're presenting something to people that really probably don't know anything about what was part of our history. To know that somebody's going to come along and see something that was used 120 years ago.